The next session is a panel discussion on understanding puberty. I request Dr.S. Yamuna, the moderator of this panel, to occupy the podium, and the panelist, Dr. T. Ravikumar, Dr. Karpagambal Sairam, and Dr. Adlyne Reena Asirvatham to occupy the dais. I request the moderator, Dr.S. Yamuna, to introduce the panelists and conduct the proceedings.
Wish you all a very good afternoon. I'm sure it's going to be very difficult to occupy the attention of the audience after a stalwart speaker and professor, Dr. Srinivasan. And we are really honored to have our teachers here, Professor Srinivasan, Professor M.K.C. Nair, and other senior professors who are seated here, to be in our midst when, as a student of them, I am able to talk about puberty with confidence. Thank you all. So now it's my duty to introduce my panelists. I have 3 experts, so my job is very less. So I have not done any evidence-based research or anything about the topic. I am here only to motivate or question the experts who are here. So I have senior pediatrician Dr. Ravikumar, who does not need any introduction. He is from KKCTH. And I have Dr. Karpagambal. She is a gynecologist from Soy Maternity Center. And of course, your own, that is Ramachandra's Medical College faculty, Dr. Adlyne, and she is Assistant Professor of Endocrinology. So we have an endocrinologist, a gynecologist, and a senior pediatrician with us. So when Dr. Sudhakar called me and he said, you will have to moderate a session on approach to pubertal problems. I said, why do you see puberty as a problem? Puberty is not a problem. Puberty is just a milestone. All of us have been through it, and all of us will have to enjoy the process in motivating our next generation to go through this process with happiness. Why did this thought come into me? It was very, very unfortunate that I had to interact with a girl child who happens to be a daughter of a pediatrician from Chennai, who was hiding her inner garments from the entire family because she was hesitant to tell her parents or mother that she has started menstruating. So why did this occur? Because there have been numerous myths about puberty, numerous myths about the menstrual periods, which has made this little girl go through menarche, and she has been going through menstrual cycles month after month for almost 18 months without any information to the family. So this is a pediatrician's child. So which means, where have we failed? We have not understood the normal physiology of puberty, and this has not been communicated in a child-friendly manner to their own children. So what is going to be the information that is going to be shared to the children who are visiting us? This is the reason why I got motivated to stimulate the audience to think about puberty as a physiological milestone. So it is necessary that all of you sit back and go back to your own pubertal days and revise the physiology. Thank you for this opportunity. Yeah, where are the slides? Slides. And there was another, okay, let them get the slides. And there was another boy of 14 years. He had started having his night emission, but he did not know what it was. So he has told his mother that I have some infection and I want to meet a doctor. So that is how he came. And he was saying that I have a major infection, so I want to know what it is. So who has failed again to inform this boy about the changes that he should be going through? And the father and the mother brought the boy. And when I asked the father, haven't you communicated with your son? He said, no, I don't think that is my responsibility. And the father was an IAS officer. So whom do you think? is responsible to inform the boys that you have also started growing up. So I think we are the only ones who, as pediatricians, who are growing along with these children to keep them informed. And that is the reason why we are here today. So, puberty is a milestone and not a clinical disorder. So, it happens in all of us. So, we start with the process. So, let me ask the senior pediatrician, Dr. Ravikumar, what is puberty? Is it an event or a process? And why does puberty take place at all?
Yeah, puberty is not a one-off event. It is a process by which a child transforms himself into or transforms to an adult. So it's like a path that from being a child, you are being pushed into being an adult. So that's like a long process, and this is probably the most challenging this thing, because a lot of changes are happening both in the child and around the child. Now, it starts off with physical changes, it starts off with physical growth, changes in the child itself sees a lot of changes in him or herself, and development of secondary sexual characters. Strange things can happen. Like she said, they may be so embarrassed to talk about certain things. Voice changes, and I've seen voice changes being a lot of children being very, depressed when the voice changes. They need to know that it's normal for voice to change. Body hair, menstruation, like she spoke about in an instance, and the inner changes, the hormonal changes which lead on to, which are the cause for the other things, the physical changes that are happening. Then emotional and psychological changes. See, this is, emotional changes, the child is growing physically, though the mental maturity of the child is still not yet developed. So the child begins to see himself or herself as an adult because of sudden growth. They become as tall or as big as their mother or father. So they presume that they would know things which the mother or the father knows. So they may, but the mental growth or mental maturity doesn't match the growth of the body. So there's a lot of mismatch, and that can lead to a lot of stress in both the children and the parents when they handle the child. And social and cognitive changes, friends formation, peer group pressure, cognitive changes, a lot of academic expectations are suddenly being thrust on the child. The child is being told about things they have to achieve, about their future. Many things the child may not even understand. Even now we don't understand a lot of things, but the children don't understand, and the parents talk to them about their future and things like that. And reproductive changes. They're sort of getting ready to bear children and and start a family. Next, please. So basically, it prepares the person for being an adult, getting ready for sexual reproduction, and along with that, the responsibilities that come with adulthood, and to start and run a family as well.
Yeah, thank you, Dr. Ravikumar. So as far as the growth is concerned, all of us know that from a single microscopic zygote, a fetus grows to minimum 3 kilogram and 50 centimeters length. And as an infant, from 50 centimeters to 75 centimeters. And after that, it is 12.5 centimeters in the second year. Then the next phase of important growth happens only during adolescence. And this particular growth is seen by the boy, seen by the girl, experienced by them. And it is essential that they enjoy the growth and they assimilate whatever is happening in their body with the scientific knowledge, as well as the thought that everyone is going through this and I am also going through this. So that is one of the reasons why the puberty takes place, and it is equipping them to a responsible adulthood. Imagine a small kid who is being held by the mother is now grow up in the next 5 years into a responsible adult who is capable of running his or her own life. So that is why puberty takes place. So when does puberty occur? Who all go through puberty, and at what age puberty starts? Let's have the endocrinologist answer this.
So as sir already mentioned, puberty is not a one-time event. It's a process, so obviously it takes some time. How long will it take? It depends on several factors, but when it should really commence, that is clearly known. So for girls, it is usually between the age of 8 to 13 when they start having pubertal changes. So the puberty clinically kickstarts between 8 to 13 years of age, and for boys it's often between 9 and 14 years of age. So all we know is that the puberty needs to start at this particular age group, but when it would really come to a completion depends on several factors. Now, having said that, this process is objectively measured or probably judged by the Tanner staging, what we call, which has 5 stages, right from being very pre-pubertal to the complete puberty. So all these children, as already mentioned by madam, have to go through this puberty and should go through puberty, because it is just like any other milestone, like how the child sits, stands and walks. Puberty is a milestone and not a disease process per se.
Yeah, thanks for highlighting it as a milestone. Again, Dr. Adlyne, what triggers the puberty, and what are all the endocrinological steps in the onset as well as the sustenance of puberty?
So puberty as a process, if you see that the core endocrinological stimulant or the regulatory signal is the GnRH pulse generator that is located in the preoptic nucleus of the hypothalamus. Now this is looked at as the hormonal trigger. It's almost like a switch button, just like how we switch on the tube light and the tube light glows. Similarly, this GnRH pulse generator should start functioning in order to stimulate the anterior pituitary, which in turn produces the FSH and LH. That goes and acts on the ovary or the testosterone or the testis to produce the estradiol and the testosterone respectively. Now these sexual hormones, the estrogen and the testosterone, will have an inhibitory effect both at the level of pituitary as well as at the level of hypothalamus, and that is how this entire hypothalamo-pituitary gonadal axis is kept in place. Now, what really triggers this GnRH pulse generator in the hypothalamus was initially thought to be very simple. The GnRH pulse generator, as the age goes up, suddenly starts functioning, kickstarts puberty. But what we understand now is that it is not as simple as a flow chart or an algorithm as seen in the next slide. So what we also understand is that there are a lot of several factors and signals that have an impact and influence on this entire axis, much more on the GnRH pulse generator. What you see on the green arrow is the positive signals or signals that can augment this GnRH pulse generator. Most important thing would be that KNDY, which is the kisspeptin neurokinin dynorphin system. So the kisspeptin is the most important hormone or a predominant hormone that can trigger this GnRH pulse generator. On the other hand, you will find that the red arrow points towards the opposing signals, which includes the MRKN3 and the GABA. These have an opposing effect of kisspeptin. So when these two positive signal and a negative signal are kept in balance, puberty never kickstarts. But when you have the positive signals or the augmenting signals taking an upper hand, the puberty kickstarts, and that is the reason why it happens as a process and not as a single time effect. Now, beyond this actual regulatory signal, we have a lot more of permissive signals, what you see in the outer circle. So you will find that there are several other signals from other systems as well. You will find that there's an impact on the GI. So we have what we mentioned is called as the gut-brain axis, where the microbiomes, the ghrelin that is secreted from the GI also have an impact on the puberty. We have psychosocial stress, the adrenal androgens, where children have adrenarche first, so the adrenal androgens that come out of the adrenals also have an impact in the pubertal trigger. So several other environmental factors like endocrine disruptors, where we talk about the bisphenol A, which kind is attributed to the precocious puberty in girls. The body fat, which again is due to the sedentary lifestyle, obesity, which is increasing in prevalence now, that also has a trigger through the leptin mechanism. So there are several factors that contribute to the kickstarting of puberty, and that is why defining a normal puberty is very difficult in the population-wise, as how we define diabetes or hypertension or dyslipidemia. It's very difficult to define puberty, but when you know that clinically there are things that are going out of place from this normalcy, then probably that becomes more pathological.
Yeah. Thank you, doctor. clinically, what features should alert a pediatrician that the child under their care has kick-started puberty? Dr. Ravikumar?
Normally, the physical changes that happen in a child, that's what signals the change that the child is starting to enter into puberty. And in girls, is usually the TLR, the breast bud development, and then pubic hair development. While in children, in boys, it is the scrotal enlargement along with the pubic hair growth.
Yeah. So that is, the girls start their puberty early, and they normally announce to the world that they have started their pubertal development because of their breast bud development. But the boys, they have a very gradual entry around 9 to 10 years of age, and the changes are starting in their private parts, and it is covered by their underpants, and most of the boys do not know that they have started growing. Even their own parents do not know that they have started growing. So as pediatricians, unless we have been examining these girls and boys every year, we will not know that the boy has started the pubertal changes. The most important change is there will be a loosening of the scrotal skin to accommodate the enlarging testis. What are the pubertal changes in a sequential order in a girl child? Because she kickstarts the puberty first. Let us listen to Dr. Karpagam.
Yeah, as Dr. Ravikumar sir said, the first thing that the mother observes, most of the time these children are actually quite independent. These girls are quite independent and they actually shower themselves. But sometimes when the mother is trying to dress the child, the mother will observe that the small breast bud has developed. So that is the time they have to realize that we have Tana staging for breast development also. So it's the first small breast bud that develops. Then there is a small elevation that can happen over a period of time, and then there is a breast mole. Then they can see a nice nipple areal or complex formation, and then the adult contour appears. But the first sign is always thelarche, and then concomitantly, after few months or few years, actually the time duration between each and every stage is very arbitrary. We can't have a clear-cut guideline or clear cutoff. Say, oh, after thelarche, after 3 to 6 months, you should have adrenarche. No, there is no clear-cut timelines between these stages. So thelarche can happen maybe after a few months of, or even a bit later also. Adrenarche happens. So you have the Tanner staging for the pubic and the axillary hair development. And then the growth spurt. So the growth spurt is very nicely noticed by the girls, notices all these things also, but the growth spurt is actually quite nicely noticed by the girl, because whenever she tries to dress up herself, her body contours changes, her height increases, the dresses that she used to fit may not fit earlier, and she feels she's growing up. They always just lift up their feet and just think that they are all growing taller, as if it comes as in the advertisements. So they also feel happy about it. That they are growing and they are becoming more matured. They think they are becoming more matured, and they can actually make decisions on their own. That is their biggest. They think they are very independent and can make decisions and things. And the final aspect is a menarche. See, menarche is actually the maximum time from a thelarche to menarche is actually 2 to 3 years. So whenever we see a child who has had a breast bud at maybe around like 9 years or so, and if the child has not had a menarche in the next 3 years, I think it's the right time to point out and find out why the child has not started. It could be an outflow tract obstruction or anything. So we have to actually evaluate. So these are the order in which it happens in a girl child. So please understand that there is no timelines, and if the mother is actually quite anxious or concerned about things, the first thing we should always do is reassure and ask them to wait.
Yeah. Thank you, doctor. So the girls start growing and their growth spurt occurs before the onset of the first menstrual period. Like I can tell in Tamil, pen valarthi, pe valarthi. Didirne the girl child will start growing up, and everyone around will keep saying, why is this girl growing? I went through it myself. Why is she growing? You will not find a bridegroom for this girl. So all these thoughts are put in by our social interpretations by the adults around us. So the growth spurt is before the onset of menstrual periods. Let me ask Dr. Adlyne, how long can a girl child grow after menarche in height?
Yeah, usually the growth lasts maybe for 3 to 5 years after the menarche, and that depends on the target adult height. So if the parents are tall and the child is left to grow, the child would grow. But Beyond menarche, the usual growth that is expected is 3 to 5 centimeters, not
That is
more
it.
than that.
So, there is no concept of growth during pregnancy or growth post-parturition. So, always they say, prasava valarti. There is nothing like that. There is nothing like the girl child will grow after the closure of her ends of the bones. What are the pubertal changes in a sequential order in a boy? Dr. Ravikumar?
No, like you said, the first will be the growth of the scrotum, the loosening of the skin, getting ready for accommodating the testicles which are growing, and it usually starts around about 9 to 10 years. Now, it's important to note that the growth of the boys will not match with the girls because it's a little different. The girls would probably grow a little quicker, and you'll notice if there are siblings of the same or cousins of the same age, you'll find the girls suddenly grow up and the boys are short. So far they would have been tall and then suddenly they seem to be short, and so they come to you with concern saying, they will, say. So we need to know that, and we need to reassure them that it will take a little longer time, or they need to wait for a little longer time. And the next two, along with the testicles, you find the penile length increasing. And this again, sometimes in parents, some parents do give birth to the children and they notice that it's not big, and they'll come to you saying, sometime 9-10 years. So again, we need to tell them that it may take a while before it grows. And many times that I have noticed this with all the sedentary lifestyle that we have, most of the boys are little obese. They have a lot of skin fold and fat fold at that area. So it seems to be more of a buried penis than actual shortening or a small penis. So they just need to be reassured, maybe given some advice for the lifestyle change and things like that. And then pubic hair again, the typical male pubic hair distribution starts. So it will be usually the testicles and then the penile length and then the hair growth, right from axillary hair to even chest hair, and then around the pubic area. And then you will have the voice change is also simultaneously happening. You will have the breaking of the voice, and then it's become more hoarse. And initially the boys are a little concerned, and then you tell them that you're actually becoming a man. They seem to be more happy. They seem to accept it, and then the body hair. And the difference between the girls and the boys would be muscle growth in boys. And in fact, this is probably one of we need to keep this in mind, especially when we advise nutrition in boys. The protein intake is probably a little bit more in boys rather than in girls. The requirement in boys, it's a little bit more. And then the acne formation, skin changes, the sweating is more. A growth spurt, like what we said, for the girls it starts from 8 to 9 years, goes on up to 14 or even up to 15 years, and for the boys it's a little later, may go on up to 16 to 17 years. And reproductive changes, where we saw now the testicles, the thing is they also start ejaculating. They may actually have wet dreams. That may actually stress the boys. They may not even, like she said, for menstruation itself, they're not saying, this and all boys will not say. They will slowly come and tell the doctor that something is coming, and so you need to tell them. And you need to also, not in front of the boy, but after he leaves or without him, you need to tell the parents that your boy might actually have some discharges in the undergarments. They need not be worried. They need not go and question the boy, because that can actually put, he may think that he's done something wrong or it's something to be ashamed of. So these are things which you probably need to tell the parents as well. But generally it's better not to do it in front of the boys. So you tell the boy that you reassure him, and then you talk to the parents separately, because they themselves may not be aware of such a thing. So they also need to be told.
Yeah. Thank you, Dr. Ravi. So the changes in the boys are gradual, and they are not as dramatic as an event that happens in the girls. And the boys are themselves not aware of the changes that's going on, and their parents are even more ignorant. The fathers, who are supposed to have gone through the entire sequence of puberty, unfortunately are not able to even recall, when I talk with them, to recall the events that they went through. So it is gradually it all happened. I myself do not know when I became an adult. So that is the kind of ignorance that is prevalent in the population. So it is up to us to motivate the parents to take cognizance of the fact that their own young boy has started growing. In fact, I can recall one of the stories. One mother, she said that all along I have been washing my son after he passes motion. At what age? 14 years. Now he suddenly said, don't come into the bathroom. That is when I knew that he has started having the adult growth. So imagine there are two errors here, parenting errors. Washing the child after passing motion till 14 years. So is that parenting? And the next thing is when the boy himself said, get out of the bathroom, that is when she knew that he has started growing. So we have a lot of work as pediatricians to take care of this population. Menarche is considered as an important event in a girl's puberty. I would want a complete revision of menstrual periods, and I request Dr. Karpagambal to go ahead with it.
Yeah, basically, it's the physiology of the menstrual cycles that all of us must have studied even from our 8th standard, 10th standard days. So basically, it's main thing is hypothalamo-pituitary. Actually, we will see what is called the hypothalamo-pituitary gonadal axis. So, no, it's hypothalamo-pituitary, ovarian and uterine axis. So, what happens is initially the anterior pituitary hormone actually produces both FSH and LH. So, with the help of FSH, actually the growing follicle, we call it the antral follicle, which will be seen on day 2 or day 3. This from the antral follicles, one of them will be recruited to become the dominant follicle. Actually, in an ovary, there are a lot of pre-antral follicles. So, they will be submerged in the stroma, which we will not be able to see. But if you do a scan on day 2 or day 3 for adult, when we do a transvaginal scan, for example, not in adolescence, so we can see antral follicles, many antral follicles, which is a sign of the ovarian reserve. So among them, one of them get recruited and become what is called the dominant follicle. From the dominant follicle, as the FSH rises, the follicle grows. That's why it's follicle stimulating hormone. And then this LH peak, which is, we have an LH surge and an LH peak. Once this LH surge starts and we have a LH peak, that is where the ovulation takes place. So the egg is released. So then, obviously if there is no pregnancy, the follicle becomes what is called as the corpus luteum. We see many times we see this corpus luteum in young girls also, and they get worried about this, what some cyst is there, and they get worried about why such as cyst in a young girl. No, always whenever we do a scan, whenever we get a scan report from anybody, any radiologist, please always correlate with the cycle, menstrual cycle, date of the menstrual cycle, either it's pre-ovulatory or post-ovulatory, even with the endometrial thickness. So because there is no pregnancy, the corpus luteum actually, which has a lot of yellowish fat, becomes what is called as corpora albicans and actually disintegrates. So this is the ovarian cycle. So coming to the ovarian hormones. So the estradiol, when you do a day 2, day 3 baseline estradiol, we don't do these tests at all in young girls. Just for our knowledge sake, I am telling that when you do, the estrogen is actually as less than 50. So when you have a very low estrogen, and then because of this growing follicle, we have two types of cells, granular cells and theca cells. The granular cells produce abundant estradiol. So this estradiol grows in the ovarian, estradiol is produced from the ovary and it peaks. So then after that, once the corpus luteum is formed, this corpus luteum produces abundant progesterone. So the second half of the cycle is always dominated by the progesterone. So this corpus luteum takes care of the fetus in case of pregnancy for the first 3 months till the placenta is completely formed. So the second half of the cycle is progesterone. So what happens when both the progesterone and the estrogen drop down, they get what is called as a withdrawal bleed. So the endometrium is shed, it thins out, then it builds up, then it sheds, it thins. So when we do a scan on day 2 or day 3, the endometrium is usually less than 4 millimeters. So we don't have to worry about this. Actually, in young girls, this physiology is actually can be a lot of variations in this physiology. So always whenever you see a scan report, try to correlate. We don't ask for scans at all in the first place in a young girl because there is no necessity for doing a scan. Even with irregular cycles, we wait at least till the age of 8 years, or we see something else alarming when they have severe pain or a mass abdomen. So these kind of things we see on scan. Please correlate with the date of the menstrual cycle before making a major decision. So this is actually the normal physiological process, but there can be a lot of changes. So this follicular phase is actually very, very, very variable. But after ovulation, this luteal phase is more or less constant. So that is the reason why after ovulation, after 14th day, this follicular phase will vary, can be anywhere between 28-30 days also. But if the ovulation has happened, the luteal phase seems to be more or less constant, and because both drop in both estrogen and progesterone, the withdrawal bleed happens. So every menstrual cycle is a withdrawal bleed because of the drop in the estrogen progesterone levels. This entire process, because of the increase in progesterone, the basal body temperature rises. So many of them I feel a bit feverish in the second half of the cycle. So actually we have to reassure them that it is because of the progesterone and nothing to worry about it. So this is, in a nutshell, this is about normal menstrual cycles. Hope it's a recap of what you have read in your undergraduation days.
Yeah, and the progesterone also is responsible for the appearance of acne.
Yeah. So, progesterone is mainly for the appearance of the acne because, see, we have a lot of sweat gland. Even in breast development, there's a lobular development and also the glandular development. So, progesterone is mainly for the lobular development and estrogen for the glandular development. Similarly, for everywhere, even in acne, these girls can have these kind of small, but most of them outgrow all these things when they grow up. So, the most important aspect is reassurance.
So acne is a healthy sign of an ovulating menstrual cycle. So that is where the pediatrician role comes in, making our girls accept the acne. So what precautions should the pediatrician take while examining an adolescent for assessing the puberty? We'll go up a little faster because they are...
Obviously, the adolescent, the pubertal age is a very sensitive age. So it's very important to explain to the children first what we're going to do. What we will be, basically you just tell them that I'm actually going to check. It's for their advantage to know how they are growing. No? They're usually more receptive rather than saying I'm going to find out something. So you just tell them it is for your benefit and then tell them where exactly you will be examining. It's better to keep, after talking to the child, you can keep, if they are comfortable with the mother or the father. Some of these children are not comfortable with any of them. Then you can probably have just a staff nurse, but generally you can ask them and have one of the parent with you. And preferably it should be in a private area and it should be done as quickly as possible.
So it's absolutely normal for a girl to go through all these emotions, and it is actually cute to watch them. When you talk about puberty or when we are discussing all these issues, these kids go through very many things, but finally they are all very attentive. They may not even make eye contact with us, but they are very attentive. How can we complete Tanner staging of puberty without causing discomfort to the adolescent and the parents? Dr. Adlyne.
Yeah, I think most important thing in any clinical examination, as we have been taught in our undergraduate days, it's about explaining the procedure to the patient, be it a simple examination or a procedure or a IV access. So explain to the patient, the child and the parents about the need for an objective way of examining and staging the puberty so that we can decide if that child needs evaluation or not is very important, and telling them what will be done exactly during the examination, and most importantly ensuring privacy and keeping one of the parents along with the child is very important. Especially when we are examining boys, we have the father, and when we are examining the girls, we often have the mother. So this is the Tanner staging for boys and girls. I'm sure you will all have it in the standard textbooks. And the orchidometer that we will be using to look at the testicular volume of the boys. So this is sometimes a bit scary for the boys, so probably we have to show them that this is with which we will be comparing the testicular volume to identify if they have already entered into puberty or not.
Yeah. So for the when we are examining, please explain to the kids what we are about to do. And for certain boys who are feeling uncomfortable, especially there was a 18-year-old boy who was studying the first year of engineering. He was worried that his facial hair was not developing at all. So when I asked him, can I examine? He said no. Then that is when the orchidometer was offered to him, and I asked him to compare and tell me what is the volume of his testis. And by then he had reached almost 25, so his growth was complete. So we can create our own ways in making the kids comfortable. So how long can we wait for the girl or the boy to kickstart puberty without any investigation? How long can we reassure the parents?
Yeah. So the precocity is something which the patient will definitely come to you. So we will not be able to miss a case of precocity both in girls and boys. But in terms of delayed puberty, we still are living in a society where parents tend to wait, the family, grandparents reassure them, and we even see primary amenorrhea at the age of 16 and 18. So what we need to know is whenever we are suspecting delayed puberty, when we have these situations, then definitely definitely warrants a evaluation. So in girls who have not developed any breast development by the age of 12 or 13, or when the child has had breast development but the puberty has not progressed beyond that for at least 3 years of duration after the menarche, or when the child has had a complete sexual development in terms of Tanner stage 5 but still haven't menstruated by the age of 15, these are the 3 situations where the girl would definitely require an evaluation. Coming to boys, again, no testicular enlargement by 13 or 14, because by the time we already mentioned that the puberty should have commenced. And when there is a span of more than 4 years between the first pubertal sign to the development of the complete development of the testicular volume, when the duration is more than 4 years, again, they also warrant evaluation.
Yeah. What should be the investigations, if at all?
I think the investigation will totally depend on the clinical scenario. So if you are really convinced that the child or the boy or the girl has delayed puberty in terms of the criteria which we have already discussed, then probably a good physical examination to stage the puberty, get some clinical clues in terms of family history, the mother's menarchal age, obesity, associated medications and systemic illness, that itself will give a clue. So the clinical diagnosis of delayed puberty can be done even without the investigation. The investigations will help us to understand and probably identify the etiology for delayed puberty.
As a primary care pediatrician, what investigations we should do as a first level?
Yeah, the first thing that needs to be done is bone age. That will give you a very good clue. If you find a normal bone age that favors more in terms of a hypergonadotropic hypogonadism, what we call as a primary gonadal failure. When you have a delayed bone age, that could either be just a CDGP or an isolated hypogonadotropic hypogonadism or even a hypopituitarism when you have other features of hypopituitarism. So the bone age will give you a clue, but beyond that I think FSH and LH will be mandatory to really understand where the pathology really lies. And if you have a hypo kind of a FSH LH elevation, then we go ahead with karyotyping. If we have hypo, we look at the other.
At that time we will involve all of you. Yeah, thank you. When should we investigate irregular menstrual cycles?
Yeah, the first thing is always important to understand that this hypothalamic pituitary ovarian uterine axis will take time for it to mature and establish a cyclicity. So that is actually depend on the GnRH pulsatility that actually Dr. Adlyne was mentioning. So please, I always tell them that the cycles can be very erratic at least for 3 to 5 years since the onset of menarche. But our community, our society parents are really concerned that they just want everything dot on time. 1st of March, 1st of April, they just expect their girls to get periods dot on time. But it is our responsibility to reassure them that, ask them to maintain a menstrual calendar of a starting date and ending date from the time they start their menarche, and ask them to bring it after 6 months and 1 year. And it is we who will tell them that, this is absolutely fine for this age. So please ask them to maintain a menstrual calendar, which is very, very, very important at all times. And it just shows that, this cyclicity, this negative feedback mechanism and positive feedback mechanism that Dr. Adlyne was mentioning, it will take time to establish and mature. So it is definitely not a cause of concern for us unless there is puberty menorrhagia, where it could be some other bleeding disorder where we have to evaluate and the girl has become very, very anemic. That needs evaluation. Otherwise, the girl has features of adolescent polycystic ovaries like signs of insulin resistance. Many times we see young girls with very bad acanthosis, even ochrocadrons in these quadrants in this age group, in this generation, because of lack of physical exercise, as Dr. Ravikumar was mentioning. So adolescent PCO is one entity that needs to be ruled out. If there is signs of insulin resistance like acanthosis and obesity, and then hyperandrogenism, features of hyperandrogenism is there, then those are children who will need evaluation. But if you do a scan on these young girls, because of the growing ovaries, most of the time they will give the report as polycystic or multicystic ovaries. Please don't get carried away by them. Even with the latest Rotterdam criteria for the diagnosis of adolescent polycystic ovaries, ultrasound is not necessary to diagnose polycystic ovarian syndrome in young adolescents. It is required, 2 out of 3 criteria is required only for an adult. Please don't do an ultrasound to diagnose polycystic ovaries in adolescents.
Thank you, doctor, for highlighting this. Does the puberty have an endpoint at all? When do we know that the kids have completed
so
their
the puberty does end when the child reaches Tanner stage 5 and their epiphysis completely fuses, which happens at around 16 years for girls and is slightly late for boys, around 17 years. But however, the facial hair sometimes in boys can be delayed. It can increase even after the age of 17. So for girls, there is a fixed point, but for boys, it can be delayed and variable.
Yeah. From now, it's going to be rapid fire. How does the puberty influence all systems in a body? About each system?
Yeah, I think beyond the reproductive effects that already Madam has discussed, both these sex hormones, both estrogen and testosterone, have a significant benefit in terms of cognition. So cognition is one important benefit of these sex hormones, and that is what happens during puberty. The second thing is metabolic health. The lipid profile, the cardiovascular risk, everything comes down significantly when these children have normal puberty and a normal exposure to the sex hormones. The third most important thing is skeletal-muscular. The muscle bulk, the bone, attaining the peak bone mass happens post-puberty, and when these children have delayed puberty or when they are not treated, remain amenorrheic, these are these side effects that these children can face as young adults.
Thank you, doctor. So may I have your inputs on the most recent trend about the menstrual cup as well as the organic sanitary napkins?
Yeah. So actually nowadays lot of young adults, even adolescents have been asking us whether they can use these menstrual cups. From ecological point of view, it's a very good initiative because it actually lowers the landfill space and it's eco-friendly. Number two is actually it is very user-friendly, but they have to learn how to use it. Number three, like they can use it for a long time because they don't have to change a pad or keep checking every 3 to 4 hours, because these cups can be used for 12 years, and if they leak, they can take the cup out and then wash it and reuse it. And the main problem here in our country is, in abroad, a lot of teenage girls have actually started using menstrual cups. But in our country, still it's a social taboo to just put something inside the vagina before the initiation of sexual activity. So I always tell the girls, ask the mother to sit with the girl and just discuss with them, and then if the mother is happy with the girl using it, then I would use it. But there are various sizes available. Medium, small, medium, large. But
so should a gynecologist be involved in assessing the sizes and inserting it?
Yeah, if they have a difficulty and they are keen on using it, and if the mothers are okay with that, maybe once they reach around 16 or 17 years and they are going to college and they will want to use it, we can help them. But definitely parental consent is definitely taken to help them, assist them, because a lot of times there are girls who are actually using it even pre-maritally. They are very comfortable with it. It is very eco-friendly, no problem. But only main problem is because I've actually had a girl in emergency where she inserted it and finally she twisted in the wrong direction and it actually went into the horizontal plane and was stuck in the horizontal in the vagina and she could not remove it. So she came to an emergency and we had to remove it. There's no choice for us. So these are the emergencies that they get land up in. But initially, there is no harm in using it from a gynecologist's point of view, as long as their mothers are okay with it. But after the age of 30 or after marriage, lot of people are using it. It's very, very eco-friendly and it's made of silicone or latex. If people have allergy to latex, they can use silicone menstrual cups. And removal is also very easy, and just they have to wash it and reuse it, and once it is done they can sterilize it and then keep it, and it's reusable. So actually the need for sanitary pads and going to the pharmacy is actually quite less.
Yeah. So I think I'll skip the nutrition requirements. Can you just put it in a nutshell? What are the nutritional requirements for the boys and the girls?
Basically, one is because of the growth that's happening, they need a lot of calories. That's a fundamental. Then the second thing is more of proteins in the boys because of the muscle mass that's being built up. For the girls, with menstrual cycle and other things, it's important for micronutrients and iron. So these are things that we need to keep in mind. So diet and things like that, that's how that's the thing we need to
do. Does the South Indian diet offer all these for our boys and girls? Do they need supplements?
Normally no. If you're going to have a good green vegetables and fruits and non-veg and things like that, I don't think they...
Because the calorie that you have said is almost 2,500 for a boy.
Yeah, rice, idli, dosa...
And 55 grams of protein from parpu sadam and tayir sadam.
Sundal konjam, see, the thing is they will not eat all those things, so that's the only thing. They would rather eat some fast food and things like that rather than more homemade food. So that's going to be
Okay.
difficult. So they would
So
need
which
supplements.
means we have to really probe into the nutritional intake of the kids. So what are the sleep changes, Dr. Adlyne? Because this is very interesting because it has a trendy.
Yeah, so the sleep duration shortens as the puberty sets in, and more importantly, the deeper plane of sleep is also altered. So if you go to the next slide, madam, there have been studies which have shown that as the LH goes up, when the puberty kickstarts, right from the age of 11 and 12 until the age of 16, the EEG has shown that there is a significant decline in the deep sleep pattern. So that is the reason probably our kids are active for a longer time with lesser sleep, less deep sleep, and they're able to have an increased wakefulness also. So probably it's all part of puberty, and I think we shouldn't blame our kids.
Yeah. So the boys and the girls will sleep late. So if the parents are complaining, it's up to us to reassure them that this is a normal pubertal change. So growing up is a curse. Restrictions and responsibilities add up. I don't want our kids to grow up. There are a few mothers who do come and tell us this. So what is your opinion about it, Dr. Karpagambal?
Yeah. See, many parents are actually annoyed with the kids growing up these days. So we have to reassure them to know that like how we had our own upbringing, because everything happened by default and our parents never bothered about it. But this is not the scenario now. We have to reassure them that it's a normal physiological process in all animal species, and please talk to the child and let the child understand the process, because that is the way that they also have to know that this is a part of growing up and a lot of changes will happen, and parental involvement these days in all aspects is actually necessary so that we build the trust in them and they have the trust in us. And we have to, they always say you belong to older generation, you do not know, your generation is different. But please, we have to come down to their level and understand their whims and fancies. And we want them to be a very important integral role in their upbringing. We don't want them to just grow up themselves. We want them to be independent. We don't want to be a helicopter parent. We don't want to be a snow-plowing parent. But definitely, it's very important to actually supervise and watch from outside what exactly is happening to them, so that we don't miss safety and security and a lot of morality, losing morality. So addressing concerns like self-pressure, peer pressure, social pressure is very, very important, because they get carried away by everything that is happening around them. Even the smallest thing, it may seem very simple and like silly to us, but for them it really actually matters. So those are things. What we would say is, feel her feels. We have to feel what she is feeling. Until unless we put ourselves in their shoes and see how this generation is taking up, I think it will be very difficult, especially for mothers. I mean, I'm sure I see quite a lot of mothers who are adolescents who go through this. And then definitely, I think we have our own responsibility in this regard.
Okay. But what happens actually, I'll come back to this. But what happens is, the concerns in the adolescent girl, she comes and tells, I have not started having my periods. I want to have it as early as possible, because only then I'll be accepted by my peer group. And how can I grow tall? But these are the concerns that the girls come to us. It is not that. It's only the mothers and the fathers who feel that the children should not grow up. But it is not the children. And see the boys, they are saying, I'm very puny compared to my classmates. When will I grow? So they all want puberty to take place as fast as possible. Okay, this is a very relevant question. So when does a boy, he can start gym activities to build muscles? Because this, again, the pediatrician is questioned about this.
I think testosterone is very important to build up the muscle bulk, and beyond which the strength training or a gym training can really help. So pre-pubertal boys, there is no recommendation to actually do a gym activity. And more importantly, rather than external weights, the weight of the body can be used. So keeping the boys and girls physically fit and physically active with a balanced diet is the key. And doing extra in terms of strength training and muscle building can be done after the puberty is complete.
Yeah. So you heard about the whey protein, protein powder, creatinine powder to enhance my muscle bulk because I want to be a macho man.
I think there are two sides to it. One is achieving the recommended daily protein intake is very important. That can be done with a focused dietary intake, regardless of whether the child is a non-vegetarian, vegetarian or vegan. And external protein supplementations are generally not recommended even as per the IAP. So because of the other harm effects of having creatinine, steroids and other toxic metals and chemicals that can be present in the protein supplementation. So dietary intake of protein is still recommended, and still I think with a focused thing we'll be able to achieve.
In short, do you discourage it?
Sorry?
Will you discourage the protein powder usage?
I think I would definitely discourage till the age of 18.
Yeah. So as pediatricians, we will have to remember this. Before we allow any kid to continue that, think twice. Are we allowing the child into a wrong practice? Okay. So what is your memory about puberty? With this, we will conclude. Each one of you.
My memory about puberty is, I don't know, at least I remember bringing up my children. So the one thing that I thought was when they come and talk to you, the first mistake that I did was immediately give them a reply, immediately try to tell them what I feel. I think the first thing is just shut up and listen to what they're saying and probably அவன் கேட்பான் என்னடா பதிலே சொல்ல நான் கேட்டுட்டே இருக்கேன்னா எனக்கு இதை பற்றி என்னென்ன எக்ஸாக்டாக புரியலடா எனக்கு கொஞ்சம் டைம் கொடு நான் மேபி ஈவினிங் I'll come back to you. At least he knows that you are thinking. எடுத்த உடனே நமக்கு உடனே அவன் என்ன obviously it will be opposite of what he is saying. So you, instead of talking immediately, you wait, you tell him, at least he knows that you're thinking something. And then respect him for able to make decisions. Never go and tell him you do this or you don't do this. He's not going to do the exactly opposite.
Yeah.
So you just tell him, this is my opinion, you do what you want.
Dr. Karpagam, your memory about your puberty?
Yeah, I have a very big family with a lot of siblings. So actually everything happened by default and we could not even discuss things too much about with parents or with our siblings. But now I have two teenage, one boy and a girl. So first time thing is, don't even talk anda kalathla. Don't even start the line with anda kalathla. That is what my children say. I said, no, I also belong, I'm a very contemporary parent. So I will be able to balance your generation, the previous generation. So I'll actually listen to them and see what it is. And I will try to explain to them. But whenever I say no, they get very annoyed. But it's like, sitting and talking. Spending time with them, explaining to them. That's
Yeah.
it.
Dr. Adlyne?
I think my understanding about my puberty is not great, but now I'm understanding more about puberty when I'm raising my daughter. So I'm learning more about puberty now.
Yeah. To recall, my adolescence has been very beautiful, being born the sixth in the family of my brothers and sisters. They're all much older than me. They all absolutely cherished me, and it was a very, very nurturing family. And in the school as well, I was growing tall. And in fact, many teachers have said, why are you growing tall? There is no boy who can match you. So this has been the kind of conversation that I've gone through. And about as far as puberty is concerned, there are a lot of milestones that we achieve academically, and that has given us the self-esteem. And obviously, I've had a beautiful adolescence. No wonder that I am able to enjoy the adolescents who are coming to my clinic. Almost 80% of my clientele are adolescents, and it is such a beautiful journey to explain to them. The boys and the girls are very, very happy to listen from a pediatrician about what it is to grow up. So this is the nutshell. So it's not an event, it's a process. Girls through drastic prominent changes, boys go through gradual changes. So it's necessary that they are informed ahead of time. Puberty is physiological and the hormones have impact on all organ systems of the body. It also brings on cognitive changes in the adolescent. Sudden attraction to the opposite gender. There are boys and the girls, they wonder, why do I keep looking at that particular person? So nutrition supplements have to be discussed with the parents. And so to reiterate that puberty is a milestone, and it is experienced by everyone. Let us bring a change in our cognition about puberty and help every adolescent enjoy this particular milestone with a smile, because it is a journey which is going to make them into a beautiful adult male or an adult female, and they are going to be independent with this particular journey. Thank you all for patient listening. Thank you my panelists who have really worked hard to put this together. Thanks organizers. Thanks for extending the time.
I thank Dr. Yamuna and the entire team. It was excellent coordination. Madam had been very, very instrumental in getting all the things. Very, very enthusiastic. I really appreciate Madam for her excellent coordination and getting this sorted out. And the most important thing is, let's uncomplicate puberty.
I thank the moderator and the panelists for the
I'd like to thank the organizers also for having invited us for this panel. Thank you very much.
I thank the moderator and the panelists for the excellent panel and a walk down the memory lane. Thank you, sir, and thank you, ma'am.